Welcome. Thank you so much for joining us for tonight's presentation, Caring for Someone with Lupus. This is one of a series of educational events we do every year. Thanks to COVID, we have really beefed up our virtual presentations, and we're really grateful that Alicia Griffith is able to present to us this evening. My name is Mary. I'm with the Lupus Society of Illinois, and we were able to put this event on because of the generosity of sponsors like GlaxoSmithKline and the success of our lupus walks and general donations from people like you. So thank you so much for joining us. I wanted to make a couple of announcements. We have our next event, which is on June 24th. We're just announcing it today, and it's going to be Living with Lupus. And mark your calendars. That one's also virtual, and it's also free with registration. And we look forward to that one. And then we do have, for Lupus Awareness Month, the virtual walk is going on right now. And fingers crossed and knock on wood, we're anticipating having a live walk in Naperville on August 14th. So really it just means our walk season is that much longer, which makes it that much better. So if you haven't been to one of our walks, I really hope that you're able to join us this year. I'm going to ask that everybody keep their lines muted. We have quite a few people on the call, and we do expect a few more people. So now I just want to go through our disclaimer. And this event is for educational and informational purposes only and serves to benefit our mission. The Lupus Society of Illinois does not provide medical advice or recommendations. This information should not substitute or replace expert medical care. Before making changes to your medical care, consult your qualified healthcare professionals familiar with your medical condition and health status. Again, this event is being recorded and will be archived on the Lupus Society of Illinois' website and YouTube page. And now, without any further ado, I would like to introduce Alicia Griffith. She is a registered nurse and patient engagement liaison for GlaxoSmithKline Pharmaceutical Company. She graduated from the University of Tennessee at Chattanooga with a bachelor's degree in nursing and psychology and began her nursing career over 30 years ago. She's worked in many patient care capacities, the most recent in the pharmaceutical industry for 17 years. Her passion for the well-being of all people drives her work tirelessly to positively impact those she encounters. She believes each opportunity to teach, listen, and exchange knowledge is an opportunity to help improve a life or lives. Her desire is for each of us to be our best authentic self. And now, without any further ado, I present Alicia Griffith. Alicia, please take it away.
Thank you, Mary, and thank you for the opportunity to share with those living with lupus and supporting those living with lupus in the greater Chicago area. Make sure, there we go. All right, so we'll get started. I will support what Mary has just said. This presentation does not take the place of a doctor's advice, and so it is for educational purposes only. Any questions you have regarding your specific care, condition, treatment, I would ask you to refer those to your private physician. So with that being said, tonight we're going to talk about caring for someone with lupus. We all know that living with lupus, being a lupus warrior is, to say the least, a challenge every day. We face challenges with living with lupus. And my goal today is to educate the family, friends, and partners of lupus warriors. I want each of you to walk away knowing that you can do what you can do to support your loved ones. So before we get started, I have a question for everyone, and I'll just say, if you'll just think through it to yourself since we are on mute. But are you a friend? Are you a family member? Are you a lupus partner? How many caregivers do we have on the line? And I guess by show of hands or a note in the chat, Mary can get back to me on how many is on the line that is supporters of someone living with lupus. So we're going to So today we're going to cover 5 different areas. We're going to talk about educating yourself about lupus, helping manage the lupus lifestyle. We'll talk about communicating with your loved ones, understanding the lupus healthcare team, and then we'll talk about caring for yourself. We know that it's so important for you to take care of yourself as a lupus warrior and a lupus caregiver, and so we'll spend a little bit of time trying to emphasize the importance of that. So first, I want each of our caregivers to understand it is so important that you are here. The first step in helping your loved one is educating yourself about lupus. And so thank you for showing up today and showing your support. We know that lupus is a chronic disease. We know that lupus can't be cured, but it can be controlled. And the goal is to control the symptoms with lupus. When we talk about symptoms of chronic illness, we know that chronic illness symptoms usually last for 3 months or longer to be considered a chronic illness. Many of these illnesses can't be cured when we label them as a chronic illness, but again, we want the goal of controlling. 6 in 10 adults in the United States live with a chronic illness. And 4 in those 10 live with 2 or more chronic illnesses. The most common chronic illnesses are cancer, heart disease, stroke, diabetes, and arthritis. We know that lupus is a long-term illness that causes pain, it causes inflammation in the body. Lupus can affect multiple areas of the body. And again, why it can't be cured, it can be controlled. So we're going to talk about how you can manage it. And remember, one of the characteristics of lupus is that it affects women more often than men. Please excuse me, I'm trying to sneeze and trying to hold it back. When you look at the frequency of it affecting women, it affects 9 out of 10 women, which means that 1 in 10 are men living with lupus. So when you think about that, men are the minority of the minorities. It's a minority within a minority when it comes to lupus. We know that lupus is an unpredictable disease. We call it a fingerprint disease, unique to each individual, because each day is different. Lupus warriors have days where they have no symptoms at all. They have hours when they have no symptoms at all, and then we call those periods remission, when they're in a period of remission. But then they have days when they have flares. Something triggers it, and it feels like it's impossible maybe to even get out of the bed to enjoy the day. The symptoms of lupus appear different in different parts of the body. It can affect different organs at any time. And the severity level varies also. So again, when I call it a fingerprint disease, because it's unique for each individual. As you can see here, one of our lupus warriors visited the usinlupus.com website, and her quote here, "Every day with lupus is unpredictable. You as a lupus warrior and you as a caregiver of someone with lupus have probably already witnessed that and know that it's very true." So as we continue, I'll be sharing some more quotes from our lupus warriors and the caregivers from our Us in Lupus Facebook page. Their stories can help us as caregivers to connect with loved ones and help lupus warriors to find the words to share their own stories. Lupus can be an invisible disease. And let me go back one. We know it's unpredictable. Lupus can be an invisible disease, meaning that the symptoms that are happening are inside, but it can be visible. The visible signs that we see here, when you get sun sensitivity or sunburn, you may have joint pain, fatigue. And I know when we talk about fatigue for a lupus person living with lupus, we know that it's just not take a nap for 15 minutes and recover kind of fatigue. We know that it takes some time to recover from that. So also know that inside the body, lupus warriors can experience symptoms such as kidney disease, inflammation, kidney issues. They may be having complications in the heart or lungs, and even blood disorders. Many of those living with lupus have heard it before. People say, "You don't look sick." That's why it's so important to help our loved ones communicate how they're feeling, what symptoms they're experiencing, because although they may not look sick, we know that they could be very, very sick. So we can't always see what lupus is actually doing, but we can be empathetic to the symptoms that our loved one is reporting to us. This is another quote from one of our lupus warriors, and she says, "Lupus is definitely an invisible disease. Through it all, we have to keep pushing." Comments like this help remind us that our loved ones are, in a fight every day, whether we see them suffering from their symptoms or not. And I want to remind you, lupus warriors, that no one is alone, that we as the lupus community are here to support you as caregivers. We can remind you how much we love you and that we are here for you and you are not alone. So I'd like to ask a question. How long has your loved one lived with lupus? Just stop and think about that for a moment. And when did they receive their diagnosis?
Lacey, it's Mary. We have 15 people on the call. If you want, I can invite people to unmute.
Okay.
You want
So let's
only answer. I didn't know you were going to be asking questions like this because I don't know how experienced people are with the chat function.
okay. And so if you want to, I'll go back.
Okay.
And we'll stop here. And so just to kind of get a count, if a few lupus warriors want to come off of mute and say how long have you been living with lupus?
Alicia, this is Charles Brummel. Nice to have you with us today.
Thank you, Charles. How are you?
My wife has had lupus for 20 years, and I've been a caregiver for that entire time.
Wow. So we thank you for supporting her. And she is definitely a warrior.
Yeah. There are no days off.
No, there's not. Anyone else like to share?
Hi, this is Brandy. I've had lupus for 8 years, and I'm excited my mom and my dad are on the call today supporting me.
Wow, thank you, Brandy. And you are a warrior also, and thank your family, your father and mother for coming on and hearing the talk today. Thank you. All right, so we'll move forward. So lupus can
Okay.
go ahead. Someone was going to speak.
Yeah, this is Donna Emery.
Hi, Donna.
Hi, how are you?
Great.
I've had lupus for over 35 years.
Oh my. Okay.
Yes. So
You've been on a journey.
Yes, ma'am. Definitely.
And do you have a caregiver with you today?
No.
Okay. No. All right. All right. Thank you. Thank you, everyone, for participating. So we'll move on. Lupus can cause long-term organ damage. We know that it is an autoimmune disease, meaning that the immune system responds in a way that mistakes our own healthy cells as being a foreign invader, or it mistakes it thinking it's like a bacteria or a virus, and it makes an auto antibody to fight against it. So an easy way for me to describe it is it's like having an allergic reaction to your own healthy tissues, and that's not a good thing. So what happens when we're having this reaction, you see inflammation in the body, The signs and symptoms of an active lupus are the results of inflammation in various organs. For instance, when lupus causes inflammation in the kidneys, it's called lupus nephritis, just as an example here. The tissue damage done with, when the organs are left untreated can cause lots of damage to your organs and cause permanent damage and complications. It can cause damage in the brain. It can cause damage in the lungs. I know you guys have experienced, some people have experienced brain fog as an example of the damage that it does in the brain and the symptoms that you may experience there. So let's talk about lifestyle. As your loved one went through appointments, discussions, and tests to reach a diagnosis of lupus, their lifestyle probably changed over time. Your lifestyle as a caregiver probably has changed somewhat. Lupus can affect your person's physical, mental, and social lifestyles. So one important part of managing lupus is keeping track of your symptoms and understanding your triggers. So let's talk a little bit about keeping track of your symptoms. So to track symptoms, it helps your loved one to identify if there's any pattern. One of the things that I like to talk about when we talk about keeping track is health journaling. And you can keep, with a health journaling, track of your symptoms, track of your medications. You also keep track of your physicians that you're visiting, your appointments that you have, any questions that you may have in regards. All of these are important things for you to remember to document when you are tracking symptoms. So you want to take notes of your symptoms. Find a time each day or once a week where you sit down and discuss your symptoms, especially with your caregiver and the person that's going to be going with you to different appointments. You want to make sure that they are aware of what's going on in case you forget some things as the lupus warrior. And so having a partner to go with you is so important also. When you're tracking symptoms, remember that every symptom matters. I know so often you're having symptoms on a regular basis and you get to a point where you feel like, okay, well, this is something I have to live with. Please remember, all symptoms matter. You want to be able to share with your healthcare provider every time the totality of symptoms that you're experiencing so that you're making sure that he is continuously aware of them and he can possibly treat them, and you can talk through maybe some of the things that you can do to treat them at home and try to minimize the symptoms. And so it's important to be proactive and make a note of how your lupus is affecting your body. As you can see, there's physical symptoms, there's invisible symptoms. All of these are signs of active disease. And so you can look here and determine how many of these symptoms you're experiencing even now. So when your loved one experiences any of these, help them to make note and keep track of the severity of the symptoms. You want to know how long it lasts, how often they're occurring, and how these symptoms are impacting their life. Remember, every symptom is unique for that individual because this, again, is a fingerprint disease. The severity and impact and the timing of all these symptoms vary per person, and you want to be able to make sure that you're documenting them and sharing it with your physician. You want to also know your triggers. So, if you are health journaling, you're able to document and see any pattern that you have. You're able to identify any triggers that you have, and knowing your triggers is so important. It gives an opportunity for you to make sure when you can to avoid those. So this again is a quote from a Lupus Warrior from our Facebook page, and she's giving a shout out to her husband, as you can see, because her husband has been there for her, she says, and having a support person is so important, and it's so important for you not to feel alone. When it comes to understanding trigger, remember a trigger is something that causes your lupus to become active in the body. Sometimes they call a trigger a flare. It's the same thing. Those words are used interchangeably. Some common triggers include stress, and stress can be physical and emotional. It can be nutrition, so you have to consider what are you eating. Do you have a sun sensitivity, photosensitivity? How much sleep are you getting? It can be a medication that triggers you a flare. It can be an illness that triggers it, or even an injury, which we know goes back to stress, being a physical stress on your body. We'll go over how to manage a few of these in the next few slides. So let's look at managing triggers. Everyone experiences stress, whether it's physical stress or emotional stress. Sometimes even an emotional event can be a stress trigger for lupus. You can help your loved ones manage stress in several ways. Like, the biggest thing is lending a listening ear and having them to talk through whatever problems they're experiencing or concerns that they have, just listening to them. Help them maintain a reasonable schedule between work and home life, or work and school, or school and home. Uh, Even balancing social outings and hanging out with friends, all of those when it comes to lupus can become a stressor, especially if it's something you've planned for some time and the day comes and you're just too fatigued to participate, and that's stress within itself, and especially if you don't have family and friends that understand the stresses of the disease. You, as a caregiver, want to lend them a helping hand and find ways that you can do that by maybe running errands or cleaning up around the house. You might even just make notes of what's going on with them. You also want to get together and do a relaxation practice like meditation or some type of light exercise. And when we talk about light exercise, we're talking about maintaining active activity, and we're not talking about physically fit, vigorous exercises, but a short walk or a stretching activity, or just moving their legs or arms when they're in a chair, or lifting even a vegetable can up and down 10 times. Those are different things that you can do to stretch out your muscles and get a little bit of exercise, and ways that you can support them in doing so. Some foods can trigger a lupus episode or a flare. You've probably heard some warriors say they have reactions to certain foods, like they might even say foods with alfalfa ingredient is one example of people saying. To better understand your food triggers, it's important to maintain a balanced diet. And one of the questions that comes up all the time is there a lupus diet? There is not a lupus diet, but there are recommendations that your physician may have for you in regards to what's best things for you to be eating. And it's important for you to track. If you notice that you're having a rash or itching, or feel like you're having swelling of your joints after you eat certain things, or even in a meal, break it down to what ingredients were in that meal. Was it the vegetables? Was it some kind of preservative? Was it the seasoning that was on there? But being able to write down what was in that meal and be able to break it down. You can also, as a caregiver, help your loved ones by one, stay on track with a meal plan. Help them stay on the track. Help them with snacks. Plan ahead if they need a snack, and look for healthy options for them when you go grocery shopping. When you think about a restaurant, think about a restaurant that has healthy options for them. You might want to look at the menu even before you go to the restaurant. Just be sure that your lupus warrior is eating a variety of healthy foods. But again, I say check with your doctor to understand the best nutritional plan that's for them. So when we talk about sun safety, it's so important to be aware about ultraviolet rays. The main two that cause damage are UVA and UVB, ultraviolet rays A and B. A is what causes wrinkles, and B is what causes sunburn. And so you want to make sure that you are protecting yourself. An example of that, try to avoid being outside in the middle of the day between 10 a.m. and 4 p.m. That's when the rays are at their strongest. If you're going to be outside, apply sunscreen 20 minutes before you go out. And the sun protection SPF 30 or above is what you need. Make sure to check to see if it's hyperallergenic, and you want to apply that sunscreen to a small area on your skin before applying it to your whole body to make sure you're not going to have an allergic reaction. If you're going to be outside more than 2 hours, reapply the sunscreen. And remember, there are clothing now that you can wear in addition to wearing long sleeves, but there are clothing that protects you from the sun. So check into protective clothing that will help shield you. I think the protective clothing rating is between 25 and 50. If you can get something higher, it's great, but nothing any lower than 20, 25, and tightly woven clothes also. Now, when you think about sleep, sleep is so important, and sleep can be a struggle for many, many people. For lupus warriors, lack of sleep can trigger symptoms. It can cause you to have pain. It causes stress. You want to try to break the cycle and help your loved ones get enough sleep. Some tips to helping them get enough sleep is get in a routine. Have a time at night that you try to go to bed. Don't go to sleep with your TV on. Try to go to sleep in a quiet room. If you need a nap, set yourself up for a 30 or 60-minute nap during the day and make that a consistent nap, and allow them as being their support person, allow them that quiet time to get that nap. Encourage them to take an active role in minimizing their fatigue. And doing so can help them, as far as having a routine, going to bed at night, no TV on. All these things will help them to fall asleep. Managing triggers is part of daily life with lupus. So on our Facebook page, you'll find someone sharing about their diagnosis and giving the tips for living with lupus. Some have diagnosis for a while, been diagnosed with lupus for a while, some for a few years, and some are visitors of caregivers sharing a quote. So this quote here is from a mother of someone living with lupus, and she says, "Anyone with lupus is truly an amazing person. My daughter has it, and I am in awe as to how she handles all the pain and symptoms." So when we call you a lupus warrior, it's because we know that you are living with many challenges. So let's talk about communicating. Communication with your healthcare team is critical, and you can help your loved ones in so many ways. So let's take a look at some of the tips that you can use in this section. Some parts of life with lupus are they're just hard to talk about. So everyone communicates differently, but it's time, to set aside some time and talk about some of the tough topics. There are some simple ways for you to get started. You might want to start with, I want you to be, I noticed the other day that, or you just start with, how's lupus impacting you? Or I noticed the other day you were blah, 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 having some symptoms. You want to share with them what your wishes are. You want them to be able to enjoy, if they're an outdoors person, going outside, and just ask, how can I help make that easier for you? You want to make sure that your loved one is in a comfortable setting when you want to have these conversations with them, and you want to make sure that they're ready, sometimes you may have to push them a little bit out of their comfort zone, but always remind them that your questions are out of love and concern for them, and you want them to live their best life and not let lupus control their life. So scheduling talks. Many talks can come up naturally, like before or after an appointment, or during or after a flare. When your loved one talks about being exhausted, that's a great opportunity for you to, get them to share a little bit more about what that exhaustion means to them. You can also ask if they'd like to plan regular talks about how they're doing. Schedule a time together about when you can sit down and plan. You can even say, like, once on Saturday dinner or Sunday breakfast. We're going to sit down and talk. And remember too that there's so many different ways you can communicate. We are a communicating society now. We have cell phones we can communicate. We can do FaceTime, video chat. We can text. We can talk on the phone. I mean, we can write notes. We can still send letters. There's so many ways that we can communicate, and it's important that we are communicating. When it comes to overcoming brain fog, remember that brain fog is a cognitive dysfunction, and it's common. It's a common symptom among people living with lupus. In fact, 50 to 80% of lupus warriors say that they experience brain fog. And so when we talk about brain fog, we're talking about they get in periods of confusion or memory loss, or just having a hard time remembering from point A to point B, and even an inability to concentrate. You want to share with them that you are here for them and that you want them to live their best life. So some of the things that you do for brain fog is write notes, put a text in the phone, set alarms, all these things you can do to help combat the symptoms that they're having. Okay? Again, this is from our Facebook page. The most difficult part is that people don't understand lupus. This is what one lupus warrior said. You have no idea how good it feels when someone cares enough to educate themselves because they love you and support you. And it's very lonely, and it's a very lonely and isolating disease. And that's one of the reasons why Mary and the Lupus Society of Illinois have support groups where you have someone where you don't have to feel so lonely. So the question here is, do you feel comfortable talking to your loved ones about lupus? So we'll weigh in on that one, Mary. Does anyone want to share? You have someone to talk to? Are you comfortable with that?
I can share. This is LaShawn. Hi, Alicia. I'm comfortable now talking to close friends and family members. I was diagnosed 10 years ago, and during that time, my children have been educated and have begun participating in different lupus activities, or, getting involved with the support group, even have presented. So I feel comfortable discussing, my symptoms, my medications, and when I'm in a flare, usually I can feel it coming on, and it's nice that they know what to do. Like, I have the middle daughter and the youngest one; they are really proactive and keep helping me maintain.
Wonderful. Wonderful. And that's the kind of support you need so that you don't have a feeling of loneliness. Thank you so much, LaShawn, for sharing, and thank you for coming.
You're welcome.
So communication tips. One of the things that I really like to say about being a good listener is being good in silence. Being a good listener, part of that is sitting with silence when they don't want to talk and being comfortable with the silence that your lupus warrior may be experiencing for a time period. Yes, we want to encourage them to talk, and yes, we want to listen and hear what they have to say, but sometimes they just need someone to sit there and be with them, hold their hand. Just know that you have that support, and I know that you caregivers understand that. Sometimes you just need the quiet. You want to prepare also. There's lupus can be such a hardship on you, a burden when it comes to finances and insurance. Preparing and understanding what do you need when it comes to insurance. Do you have coverage when it comes to your medications? How's the medication supposed to work? Are you having side effects? Are you able to live with these side effects, or is you need a change in your medication? I just encourage you, as someone who is supporting a lupus warrior, try to be patient, try to be understanding, and share openly, even your concerns about them. Share openly. So communicating with your loved one doesn't always have to be, again, a conversation. Listen to their silence and observe. I tell people all the time, and I know LaShawn was just on and says, and she probably can relate to this. I tell people all the time, I've been a nurse for 30-something years. I get paid to observe. And even when I'm not being paid to observe, it's just what I do as a nurse. So even in my personal life, day to day, I'm a huge people watcher. I just observe behaviors. I look at facial expressions. I look at body language. All of those things are so important when it comes to, helping support your lupus warrior. So, paying attention, being helpful there, running errands for them, helping them, doing exercises that relieve their stress. So let's talk a little bit about health management. And when we talk about that, we know that there can be a huge team when it comes to healthcare. We see here there's 12 different people listed as a part of this team, and you, the lupus warrior, are the captain of your ship. And if you're not the captain of your ship, then your loved one, the person that's there supporting you, needs to be, because guess who shows up to every appointment? You, the warrior. And it's so important for you to be prepared when you show up. Have your notes. Be ready to share. When you went to see your dermatologist or nephrologist, report the results back to your rheumatologist, because sometimes they get the notes in a timely manner. Sometimes they may not. Sometimes they have time to read them before you get there. Sometimes they don't. But jogging the memory of your healthcare provider so that everyone is communicating and sharing the valuable information so that everyone is on one accord about your care. But again, you are the nucleus. You are the center. You are the designated captain. And I know in healthcare before, we used to, identify the physician as a captain, but your partner is not just a physician. You're the one that is at every appointment with every provider, with every nurse, with every respiratory, physical therapist, psychiatrist, whoever it is. And so make sure you're relaying that information. You want to keep everyone informed. You want to keep everyone up to date on what medications, because sometimes the left hand may not know what the right hand is doing, and you're the one that brings your team together. And so you, as the one caring for your lupus warrior, you're that appointment buddy. So take good notes. Be prepared to ask good questions, and remember those questions that you talked about at home that you really needed answers to. So ask those questions. You want to make sure you're addressing any concerns that your loved one has, and make sure that you are clear on what the response from the doctor is. So sometimes it takes two sets of ears to get a clear understanding of what the plan was. Because again, our lupus warrior may be having lupus fog that day, and they may not be able to remember from the exam room to the appointment desk what was discussed, or some details of what needed to be discussed. This is a survey that was conducted by GSK with over 200 lupus patients, 100 caregivers, and 75 physicians. And with that study, what they found is 61% of patients said that they minimize their symptoms, or they make them seem less severe and less impactful. Lupus warriors, I say to you, all symptoms matter. Do not minimize. Share with them what is going on with you so that you can get appropriate treatment. 76% of patients believe that their lupus patients have difficulty communicating the support that they need. And you showing up with your loved one, your significant other, your partner will help you to be able to communicate. This is a quote again from our Facebook webpage, SM Lupus webpage. This person says they were diagnosed in 96. Every day is different for sure. The journey is definitely real, especially when some of your family, friends, and co-workers will never understand. Lupus warriors, stay strong and be there for one another. So I asked a question. Have you helped your loved one with an appointment? So this question is directed to the caregivers. Have you helped? I know the answer to this has got to be yes.
Alicia, this is Charles Brummel. I go to all of my wife's appointments and I've been doing so for 20 years. I
Wonderful.
actually help her with the scheduling of the appointments. And as the caregiver, I take her to the appointment. So yeah, I'm heavily involved with that.
You know, Charles, and I'll say that is so wonderful. You know, I speak in 9 different states from Wisconsin to Florida, and all lupus warriors don't have that support. So I say to you, thank you, and I know your wife has said thank you millions of times, but thank you for setting an example. Thank you for supporting the warriors here also. So let's talk about tips for speaking with the healthcare team. So important for you to be sure that you understand your role and understand your doctor's role. It's so important for you to be able to communicate your concerns, communicate your symptoms, and get the treatment that you need, you know, and keep talking, keep sharing. Again, every symptom matters. You want to make sure that you tell it like it is. Keep it real. Share with them exactly what's going on with you. You can help gauge what goals are best suited for you. You as a loved one, a caregiver, you can help also, because if they are saying that your lupus warrior needs to walk a mile every day and you know that they can't walk a quarter of a mile, then let's speak up and say, hey, let's start with 1 lap, you know, just as an example. But keep the goals realistic and help them keep it realistic. And you want to also do some research. Keep learning. Learn as much about lupus as you can. Learn as much about the treatment options that you have, and so that you can share and ask questions when your physician offers your treatment. Be appreciative too. We always want to remind our team how appreciative we are of them. So let's talk about self-care. It is so important for you as a caregiver to take care of yourself as well as the lupus warrior to take care of themselves. Sometimes we feel a little guilty and think that if we take time off or time away, that we're not showing the love. It's not true. You got to take care of yourself in order to be able to take care of someone else. Caregiver stress is real, and lupus is a stressor. And so being there for someone every day sometimes can be stressful. Trying to figure out, are you providing the emotional support that they need? Are you providing the financial support that they need? Are you providing the physical, being there for them on that? Are you there to help listen and communicate? Because sometimes you probably get tired, you know, and it's okay to step away. It's okay for you to de-stress. In order for you to be healthy, you've got to be able to do that. When do you start to feel the stress? When you start to feel the stress of being a caregiver, what do? Are you taking care of yourself? What are you doing to take care of yourself? Are you walking? Are you reading? Are you, you know, taking a soak in the tub? I don't know. You've got to have something that you're doing to take care of yourself. Self-care for the caregiver. If you're feeling overwhelmed, you got to ask yourself some questions. why are you feeling overwhelmed? Is it because you haven't stepped away? You're feeling selfish because you're healthy? And are you feeling selfish because you feel like you need to have some relaxation time? Don't. All of us has to de-stress. We have to step away if we can. Do your health check-ins. Are you following up on your physician's appointments? Look at the things that you can control because it does your lupus warrior no good if you're not taking care of yourself. I asked a question. Are you practicing self-care for yourself?
Yes.
That is good. Very good. And so this is a quote that one lupus warrior placed on Facebook. This person says, I have an amazing friend that maintains her lupus like a champion. I try to educate myself to know what she deals with. That's from a caregiver. So I'm going to stop here, open for questions. And while we're doing that, I ask each of you to get out your cell phones, open up your camera, and I want you to focus in on one of these 4 QR codes. These QR codes take you straight to our usinlupus.com webpage. You're able to go through there, learn a little bit more. Some things that I haven't covered are on that webpage. This webpage has been updated for about 6 months now, and I'm really proud to say it's a stronger resource than it ever has been. So get your phones out, guys. I want you to go to your QR code and find something on there that may be helpful for you.
Thanks,
And I'm
Alicia.
going to stop right here, and open it up for questions, Mary.
Sure. And the Us and Lupus website really does have a lot of really helpful information, supporting information for a lot of the topics that you talked about. It does look like we have somebody who's unmuted, I'm guessing. Is there a question from Elle? Okay, I'm guessing that wasn't deliberately. If somebody has a question and they want to unmute themselves, that would be fine. I do want to ask a question. We have some really wonderful support group leaders on the call, and we have some really wonderful volunteers. I don't want to out them, but I want to invite them to share with them, maybe share with us, the group, 1 or 2 things that a caregiver did for you, or that you heard a caregiver did that you really felt like was outstanding. So I don't want to out anybody, but I will. Just kidding. Charles, do you have something?
Yeah. There's one thing that we've been practicing, my wife and I, for the 20 years that she's had lupus, that we feel is helpful, and that is we learn to take her blood pressure and temperature every day, and then we log it in, and we're able to see how she's doing, in part because of that. It's amazing what kind of information you can get from watching your blood pressure. And if you are tracking it all the time and you see it all of a sudden higher than normal, you need to be alert to that. So that's something that we've practiced, and we've had lots of conversations with the doctors. My wife is a kidney transplant patient, and her nephrologist looks at her notes on her blood pressure every time we visit with them.
Wow. Thank you for sharing, Charles. That is great.
Yeah. LaShawn, do you have something?
I can share a few things. I have a daughter who is in school for physical therapy, and when my lupus is really, really aggravated, I have problems walking sometimes. You wouldn't know that if I didn't tell you, because most people don't see that side of me when that flared up. And she rotates ice and heat, and then she'll do a nice massage and stretches for me. I mean, there are mornings where I've text her to come down when she's home to kind of help me get out of bed to get started, because sometimes in the morning it kind of takes, it could take 30 to 45 minutes. It's almost like my brain has to send a signal to my lower extremities to move. And some people that know me know, okay, this girl does a whole lot. And that's probably one of the reasons that I do, is because I have fear that, okay, if I stop doing things, then I won't be able to. I have another daughter who is a pharmacy student. And so I get so busy with work or reading, studying, I'll forget to put my medications in the pill box. And she knows all the medications, so I may come home and it's like already done. And she'll say, Mom, I know you're really busy and I don't want you to forget your pills. So I set them up for the next 2 weeks or something like that. So those are two good caregivers right there.
Wow. Thank you
Yeah,
for sharing. That's great.
yeah.
This is Mari. I have my mom and my daughter, and I'm the lupus support group leader for Lupus Spoons and Lupus Spoons 2.0. And my mom goes with me to all my doctor appointments. And during COVID, when she couldn't go, I actually videoed with my phone to my dad's phone, and my parents were both there with me with my appointment. And my rheumatologist, he already knows that I go in with my list of questions, and he's like, okay, what's first on the list? What's next? What's next? And he gives me time to write down my answers. And then he goes to my mom and he looks at my mom and he's like, all right, Mom, what questions do you have? You know, what do you think that, you know, that she needs or something? So he always goes and talks to her and asks her, you know, what else. And my mom and my daughter are both there with me during my lupus support groups. And they don't just sit there and listen. They actually input, because I have people in my group that don't have lupus, but they are caregivers and they want to know how to care for someone with lupus. And so my daughter and my mom can give them input, and, you know, they have conversations. So I have a lot of support. My dad just recently bought me my own laptop because I would have to go to my mom's apartment, which is upstairs, for my lupus support groups. And now I can actually do them in my own apartment. And my mom and my daughter come here. And then, like LaShawn was saying, of her daughter coming to her house and helping her, there are some days that I can't get up from the bed, and my daughter and my mom will cook something, make something to eat so that I'm able to take my medicine. They'll give me my medicine and food. So I thank God I have a great support team at home. My brother designs my shirts for my lupus support group walks, and so I have a lot of support at home. Unfortunately, some of my people in my group don't have that support, and my mom always says, well, count me as your mom, as your other mom, and I'm here. So I have a lot of support. So I'm very grateful to my family for being there for me.
That's amazing. Thanks, Mari.
Hi, this is Sandra.
Hello.
Um, I just wanted to say that I live in a city where there is no family and most of my friends have moved away. And I also wanted to, so I'm taking care of myself and I do have my team of physicians. But I wanted to say that when the host asked us to take out our cell phones and take a picture, that was an assumption that we all have smartphones. I don't have a smartphone, so I don't know how to even get that information that
Well,
was
no.
told.
Okay. Do you get our email?
I get your emails.
Okay, so I will include, or if you want to send me an email, I can send links right over to you. But it's the Us and Lupus website, and they have a lot of great tools. But that's a really great point. So please do forward me your email, and I will send it to you directly. Anyone can do that as well.
Okay, is that with Mary? That's not Mary that's talking? I can send it to Mary, but I don't have the host address.
It's mary@lupusil.org.
Mary, I've got it. Yes.
Awesome.
You and I
Wonderful.
have even communicated. Okay, thank
Have
you.
we? Oh, great. Thank you. Does anyone else have any outstanding stories of caregivers that they want to share? If not, I guess my last question, I know we're kind of running out of time, would also be to the group, and it would be, what advice would you give to someone who's new to caring for someone with lupus? Does anyone have 1 or 2 tips for them?
Like Elise said, this is Mari again, I'm sorry. Like Elise said, they need to also take time for themselves. When my grandparents were alive, I was their caregiver, even though I was sick. And there was days that I said, I need a timeout, and I had to actually ask someone else, you know, you need to be in charge of grandma and grandpa. I need a timeout because I'm getting burnt out. And if I'm burnt out, how can I help grandma and grandpa? So sometimes I get angry at mom because she wants to be there all the time. And I'm like, you need a timeout. I can do this by myself. I can actually do this by myself. And so that she can recuperate, because I mean, she just turned 70 and it's like, she thinks she's 20 when she's with me. But so they really need to take a timeout for themselves and don't feel guilty, because we feel bad you always being with us, and we know how you can get burnt out. So you do need to take care of yourself, you know, to be able to take care of us.
That's a really good point. Elise, do you have any thoughts on that you want to share from your experience?
Yeah, I just support just what was said. You gotta take time to yourself as a new caregiver, and remember that if you're not healthy, you can't help anyone else. And the biggest part of that is the mental health. You know, sometimes you gotta find a way to turn it off, and not taking on so much every day. So the mental health of it is a big part of that timeout.
Yeah. Okay, great. I think it's also, if anyone has any questions later, they're welcome to forward those over to me at mary@lupusil.org, or feel free to give me a call. And I guess the only other thing I would add is that the support groups that we have and the support group leaders who are on the call can correct me if I'm wrong, but the support groups are open both to caregivers and to people living with lupus. And I believe that, you know, I know working in the office, we get calls from parents or spouses who sometimes struggle taking care of the people that they love. So we suggest that they go to support groups, and if not, then we also have an individual peer support that we also put caregivers in touch with other caregivers, just so that they can get that additional support. Lupus is an incredibly challenging disease. No two people have the same situation, but in a sense, the uniqueness of the disease is what is common, right? So people can relate to that part.
And Mary, it's Alicia. I was just going to add to that. Educate yourself. You know, continue to learn as a caregiver. Like what Charles just said here, if they show up for a support group, just listening is an opportunity to learn and pick up. I mean, even me as a nurse, hearing Charles say that, it just made so much sense, because it's subtle changes that if you notice those subtle changes, you may be able to head off a full-blown flare. So yeah, educate yourself as much as you can.
Yeah. All right, wonderful. So we've got about a minute left. If anyone has a question, this would be the perfect time. If it comes to you later, please do forward it over to me and we'll get back to you. I hope everyone joins us next month for our next presentation, Living with Lupus.
Yeah.
Registration is free but required because it's virtual. And with that, I will just say thanks to Alicia and thanks to everyone for calling in, and thank you for sharing your comments. And I look forward to talking to everybody soon. Thanks so much
Thank
for
you,
joining.
Mary.
Okay, thank you.
Thank
Thank
you.
you.
Thank you, ladies.
Thank you.
All right,
Thank you, Lee.
bye-bye.